right, ladies and gentlemen, you're right back here on the Scenario Radio Show. And like we always do, man, we always like to make sure that y'all are tapped into each and everything regarding the scenario. Find us on doperadiofm.com. Of course, you can go into the Spotify playlist. This playlist we have today is going to be added to the sexual healing playlist that we got set up for you guys, man. Make sure you're following us on Twitter, Instagram, Facebook. And also, man, you know what the deal is. Go into the scenarioradioshow.com bios, things from old information, man, old shows. We got it all lined up for y'all, man. So make sure you stay locked in.
All right. Like Big Cub said, it's all right there. We're going to keep the conversation going. We have another friend of the show, Dr. Millard D. Collins. Do not forget the D. From Meharry Medical College. Glad to have you on with us. It's been a minute. We've been talking about sexual health, and we've been talking about the connection with a lot of mental health issues and sexual health. And we wanted to bring you on to get into some of the physical health parts of it. Some of the things Renee Burwell had brought and mentioned earlier. So a lot of times people don't think about their sexual health in terms of, as I mentioned earlier with Renee, especially with outside of the erogenous zones, outside of their genitalia. It's like, okay, if it's not something that's not functioning there, they may not think about anything else. What's one of the biggest inhibitors to good sexual health that isn't directly sexual?
Well, thank you for having me again. The thing about sex, the irony of it is, it's something we envision, as a mature act, but really, many of us are very immature about many aspects of sex. And for me, one of the biggest things is communication. Whether it's a patient communicating, a sign and symptom to their provider, or even partner to partner. I was going to say this for the end, but sometimes, I was really enjoying Renee's comments. Sometimes we need to be whisperers, and we can get things kind of moving. And we kind of think it's all about the physical act, but the libido, the arousability of each other is something that's very, very important when it comes down to sexual relations.
Okay. So when you talk about women, I know we focus a lot on hormonal problems. Are there other problems or other concerns that women have to look out for outside of the hormonal area? I can't think of any, but I guess that's my question to you. Are some of them things we should be looking out for our sexual health that are non-hormonal?
Well, yeah, I think I was glad to hear Renee mention my trauma. Trauma is a big one. Sometimes, you can't articulate what it is because it's something that may not be in the forefront of your mind. But depression is a really, really big one, not just a depressive symptom itself that might decrease your interest, your arousability, your mood. Sometimes you're on medications that can cause the same effect. And many of our physiologic, responses are stimulated by nerve pathways. So uncontrolled diabetes, whether you know it or not, is something that really, really does it. With men, it's a little bit easier. To your point, KB. If you can't, I don't know any way to put it. Parasympathetic and sympathetic is the nervous innervation. So we call it point and shoot. That's how we kind of explain it. In the medical world, if we know about erectile dysfunction because it's an outward demonstration of your success or your failure in terms of arousability. But we live in Nashville. There's a lot of construction, and imagine if, no matter how much you're trying to get to that pothole to fix, if you can't get the materials to its destination, nothing's going to happen. So if you have nerve issues with diabetes, or you have vascular issues with high blood pressure, peripheral vascular disease, nothing's going to happen no matter how much. And the last thing I mentioned about hormones is, is low T. People talk about testosterone in men a lot. It's not just about the erection. It's also about muscle mass. It's also about being fatigued, et cetera. So any of these symptoms, I encourage all people to discuss it with their providers.
And I have some things I wanted to add too, especially because I was thinking, I was like, we've been kind of talking about penises a lot. And I definitely wanted to talk about vulvas. So there are several things to think about when it comes to people with vulvas. One, I think the hormones, testosterone is a hormone too. So we're still kind of focusing on that area. But there's a lot of people who have vaginismus, which means that they're unable to be penetrated. So this is my example of a pelvic floor. And what happens is the pelvic floor gets really tight. A lot of times due to stress, sometimes it's due to a lot of different things, where even a tampon can't be inserted into the vagina. So that's one area. So stretching is extremely important. Also, with stretching, as women get older, atrophy can happen where they get more dryness and their flexibility just doesn't happen as much. So making sure they're stretching, whether it's digital stretching, using a vibrator, using a dildo or penis. There's so many different ways to stretch, but stretching is extremely important. Lubrication is extremely important when we're talking about people with vulvas. So having a water base. Some people will use spit. I'm not big on recommending spit because is bacteria in your mouth that can definitely create issues within the vulva. So you have the lubrication. So like water-based, silicone-based, depending on how dry you might be. Silicone is better for more anal play, but you can do a hybrid sometimes when it comes to vulva play. But also keep in mind, when it comes to lubricants, you want to make sure you know your ingredients, because the vulva is extremely sensitive in comparison to the penis. You can put, I don't want to want to say what you could put on a penis, but a penis is very resilient in comparison to a vulva. So again, stretching, lubrication, and moisture. So like making sure you're constantly drinking water and taking care of yourself. Those are ways to really maintain vulva health. And then, with stress, mental health, and one thing that we haven't talked about, Dr. Collins did mention, am I saying your name right?
Yes.
Okay.
Yeah.
Dr. Collins did mention is medications, like people who are on antidepressants, SSRIs. A lot of the mental health medications actually create sexual dysfunctions. So, I always want to name that too. So like whenever you're thinking about getting on medications, you want to make sure you're talking to your provider about what are the sexual side effects, and make sure you're weighing your pros and cons as to what you're willing to risk and what you're willing to gain in order to be on different kinds of, to make sure your quality of life is whole.
Yeah.
Okay.
Thank you for that.
Here. Penises are resilient and trying to fix the pothole. Cool. I'm just making sure I know down that I know I'm going to end up using, because it's I like
penises.
That.
Our bodies are very similar. Like if you see, like a woman's is just a person who is assigned. I'm trying to be as appropriate, but someone with a vulva. It's just internal. But we really have the same body parts, but one's internal and one's external. So a lot of it, we're not built the same, but we do have a lot of the same mechanics.
Yeah. And, my question always is, because now with everyone having so much information now, has it become easier, I guess, per se, trying to help people navigate, any kind of questions they have about the sexual health, just because people have more information, so they may want to know more about it? Have you found, Dr. Collins, that it's been a little easier because people have this info and they're kind of want to come to you and try to find out, what's going on, as opposed to back in the day when, especially for Black men, we didn't want to talk about none of that?
Brian, it's a double-edged sword, man. Some have so much information that they try to do the self-help, and they go and try everything else. The corner store is the mecca for a lot of men. These special pills, the honey packs, and all these different things, and they swear by it. But what happens when they don't work? Then they come to us and expect us to just give them some Viagra, or Cialis, or testosterone. I can put all in your car, but if I'm not stopping what's making it leak, it's not going to make a difference. And unless we address those chronic diseases, the blood flow, peripheral vascular disease, people who smoke, it makes the blood vessels tight. So it makes it very much more difficult to get, because blood is the thing that engorges the male sex organ as well as the female. So if you have to just engage in these discussions, because it's different levels to it. It could be the difficulty in getting an erection. It could be the difficulty in sustaining an erection. And, long are the days where, a lot of men think, long and strong is desired. Many times they come in and they can't achieve ejaculation. So there's different phases. And I think unless you get into a meaningful discussion with your provider, trust needs to be there. We won't get down to the root cause analysis so we can fix it. And frankly, as I mentioned, it's very, very, a lot of us are very, very immature about this. And I heard Renee mention this when I joined. The bravado, we know it. I've been doing this for 20, 30 years. I know all I need to know. But it's much, much more than that. And it gets more complex the older we get, as our bodies start to fail a little bit.
One of the things we were talking about about the whole idea of physical health and how the body changes over time, and you have to help a lot of times patients figure out how to navigate intimacy in new and different ways. Do you find, how does that happen? Because what I envision is that in some cases, sometimes a person has a physical ailment that they can't, it's not going to get fixed immediately, or if it gets fixed at all, things never may go back to how they were. And some people, I can imagine that's a heavy weight to carry, the pressures that they may feel sexually or otherwise. How do you help people get around that, or get to a place where they can still enjoy and appreciate intimacy in new ways in the physical condition that they are in?
Okay, so this is kind of multi-layered for me. First,
Uh-huh.
I would really like for people to possibly do what we call a sexuality attitude reassessment. And what that is kind of like a weekend of just watching a lot of explicit materials and seeing how sexuality can look like a lot of different things. A lot of us, when it comes to sexuality, we just think of penis and vagina or some form of insertion, or it's not sex. And really, sex can look like a lot of different things based on people's capabilities and what they have. Some people don't have hands. Some people don't have mouths that open. Some people aren't able to be inserted, or they might not be able to be penis focused, depending on what's happened to their bodies. But what they can do is the biggest sex organ is our skin. So, there's other areas of our body that can receive pleasure and be sensual and erotic, but you have to find that and you have to explore that for yourselves and with your partner. And sometimes you may need assistance. Some people need sex surrogates. And again, that's kind of a tough place because in Tennessee, sex surrogacy is not something that's necessarily legal. But some people may need aides and different people to help them with their sexuality over time, depending on where they're at. And the reality is, if we live long enough, all of us will experience some form of disability at some point in time that may need assistance around sexuality or may need assistance around other areas of quality of life. I hope that answered your question.
Oh, yeah, that did. And conversely, I wanted to ask Dr. Collins. So a lot of times you may find yourself in a situation where you are dealing with people who have a physical ailment, and you see that it's having an emotional effect and an emotional impact on them. And even though you're not, mental health isn't your forte, how do you help them manage that? What's the best thing that you feel like you can do to help someone in that situation where they have a physical ailment that you are attempting to treat and maybe treating as best as possible, but in the meantime, it does have some kind of mental impact, even beyond sex. But how do you find yourself having to deal with such things?
Ben, very similar to what was just said. As a family physician, my patient's health is probably 65% of the time affected by their psychosocial health. And I'm a pretty creative and a pretty direct individual, but I believe in setting both short-term as well as long-term goals. So if a patient may be not able to do a certain thing, that's the resilience of the body. For instance, I had a female patient who came in and she was struggling with this back pain. It was chronic. And she was saying she can't, I don't know any other way to put it, she can't get on top and do her thing anymore like she wants to. Mm-hmm. And I encouraged her playfully, but with her husband there, to tell her to try something different, maybe lay on your side, find a different, favorite position. And, and you have to keep on trying until you find something that works for you. I think short term, they can try other things that can really, really help. Have a pregnant patient, for instance. She was Hispanic, she loved to cater to her man. And he came in that day as the patient. And I was laughing because physiologically, grown men should not get blue balls. But that's what was going on with him, the pain, the symptoms that he was describing. And she said, well, the doctor said I can't do anything. But she meant, with her vagina. Mm-hmm. And we talked about self-pleasure. We talked about, mutual self-pleasures because she couldn't be penetrated so that she can maybe achieve climax. And of course, there are other things that they can do as a happily married couple, because safe sex is the best sex. That's my plug for that as a physician. But the resilience and people's ability to adapt to the new normal, much like COVID, I think you have to engage them in conversations and give them that room for trial and error. And I agree. Looking at visual cues can help. And it's not just hardcore porn. There's a lot of things in between. But whatever floats your boat to kind of get that stimulation, I certainly have presented to patients and encouraged them to give it a shot.
This is the Scenario Radio Show. Real talk with a playlist.
That's the scenario.